Allopurinol and Febuxostat are both xanthine oxidase inhibitors. Now, a crucial difference between these two drugs are in their structure. Allopurinol is a direct analog of your purines. Now, your purines are adenine and guanine, and you can see that they're both characterized by these two rings. Now, both of these drugs are considered chronic gout drugs, meaning that a patient with gout is going to be prescribed this as baseline therapy that they're going to be taking once daily for essentially the rest of their life. Now, when we are breaking down these purines, adenine and guanine in our bodies, the two final steps before they are converted to uric acid involve reactions catalyzed by xanthine oxidase. Now, hypoxanthine and xanthine in and of themselves are considered analogs of purines, and this is why allopurinol is so effective. It's because it mimics these two substrates to inhibit xanthine oxidase and bind to the substrate binding site. Febuxostat, on the other hand, binds to a different binding site, and it doesn't matter whether the hypoxanthine is bound or not, it's always going to inhibit xanthine oxidase, whereas allopurinol acts more of a competitive inhibitor because it's competing with these two substrates. If we inhibit xanthine oxidase, our uric acid levels are going to drop, but our xanthine and our hypoxanthine levels are going to increase. Now, this is actually a good thing because both of these substrates are actually very easily excreted into your urine, whereas uric acid is going to deposit in your joints and cause your classic symptoms of gout. It's also important to know that these xanthine oxidase inhibitors cannot be prescribed with azathioprine or 6-mercaptopurine because these are also metabolized by xanthine oxidase to form uric acid. If we are inhibiting xanthine oxidase, these are going to increase. Now, these are immunosuppressants used commonly in organ transplants, organ donations, some autoimmune diseases like lupus, rheumatoid arthritis, and it's even used in some cancers. Another important note you should know between these two drugs is that allopurinol is considered always the first line. This is because it's effective, it's well studied, and it's cheap. Febuxostat is used as an alternative in many situations, but the most important situation and the most common situation where febuxostat has to be used as an alternative is in the case of the presence of this gene in your patient, HLA-B5801. This gene is going to increase the chances for hypersensitivity to allopurinol. And if patients have this gene, they're going to have a really high chance of developing a hypersensitivity reaction such as Stevens-Johnson syndrome or toxic epidermal necrolysis, and it's going to lead to this really nasty skin allergic reaction. If you're a doctor and you have an Asian patient that's presenting with gout, usually what you do is you screen them for this gene, and if they do have it, then you give them febuxostat